Welcome back, everybody, into Good Morning Arkansas. Of course, the ABC News, breaking news from Washington, which you just heard. We're going to have more on that today on Midday Arkansas at 11:30 and on live at 5, 6, and 10 o'clock. But now back to our show. Really happy to have in studio today Dr. Rayburn Rego, a CHI St. Vincent physician with expertise in advanced endoscopy. Today, Dr. Rego, thanks so much for coming in. We really appreciate you stopping by. First, let's just talk about what exactly it is. What is advanced endoscopy?
Yes, endoscopy is
endoscopy.
Yes, let's talk about endoscopy first. Is the use of a flexible tube with a light at the end of it. And this goes down a patient's orifice in order to visualize the gastrointestinal tract.
So down the throat?
Down the throat or through the rectum.
Okay, gotcha.
And commonly this would entail an upper endoscopy or a colonoscopy. Advanced endoscopy is a little different in that it uses specialized scopes in order to do specialized procedures such that one can remove pre-malignant lesions or access the common bile duct and pancreatic duct. And these are specialized scopes where one can look at the layers of the wall of the gut and even beyond by endoscopic ultrasound, or access the common bile duct and the pancreatic duct with a specialized side viewing scope. So that is what we call advanced endoscopy.
Okay. You mentioned treatment of diseases. What are some of the specific diseases that are diagnosed and treated with this?
Yes, with the advanced endoscopy, you can diagnose malignant lesions, pre-malignant lesions. One can also diagnose, for example, stones in the bile duct or the pancreatic duct, as well as diagnose certain cysts that can be treated endoscopically. So those are some of the diseases that we commonly encounter, and endoscopy or advanced endoscopy is performed to treat these conditions.
How does advanced endoscopy differ from just endoscopy?
Yes, so the technology is different. The scopes, like I mentioned earlier, are specialized scopes. For example, endoscopic ultrasound can visualize the layers of the wall of the GI tract and even beyond. So structures such as the pancreas, liver, gallbladder can be seen quite clearly by endoscopic ultrasound. And then we have additional tools in order to perform certain treatments for these conditions, such as removing a pre-malignant lesion from the stomach. And so this is not regular endoscopy. This is advanced endoscopy that we're doing.
That sounds pretty impressive, the technology these days. Okay, is specific expertise needed for the use of this technology? Very specialized?
Absolutely.
Yeah.
So in my situation, I finished a fellowship that entailed 3 years in gastroenterology and hepatology, and in order to do advanced endoscopy, I had to undergo an additional year of training. And then, of course, I finished my training about 12 years ago, and so the experience comes into play as well. So I've been in the practice for about 12 years doing mainly advanced endoscopy, and things change, you know, as things go along, as years go along. So there are new techniques that need to be learned, and there are new developments in the field. And then one has to keep abreast of these. So I attend courses and hands-on workshops and watch videos and continue to develop in the field of advanced endoscopy. So it's an ongoing field. It's not static.
Yeah, it never gets old, does it?
It never.
Always something new, right?
So yes, absolutely.
And once a diagnosis is determined, what's the next step for a patient after that?
At St. Vincent's, we have an excellent interventional endoscopy center or gastrointestinal unit where we do a package of these advanced endoscopy cases. So, for example, if we removed a pre-malignant lesion from the stomach, it's probably all that's needed. But there are some situations wherein we diagnose malignancy, for example, and we can tell by advanced endoscopy if the patient is a surgical candidate or needs some other form of treatment such as chemotherapy. So then in that situation, the next step would be to refer to an oncologist or a surgeon for further management of the disease process.
Okay. Well, there's certainly several different ways that you can contact St. Vincent, CHI St. Vincent, the gastrointestinal clinic there, of course. Gastroenterology Clinic. There's the number on your screen, 501-666-0249, or you can go to their website as well. Dr. Rego, thanks so much for coming.
I also want to mention one thing, that this technology and this expertise is available probably only at St. Vincent's in the whole state. at the moment.
Wow. Okay.
Yes.
So if you're looking for that type of treatment, or of course that type of diagnosis to find out what you need, you'll find it right there at CHI St. Vincent. Dr. Rego, we'll see you next time.
Thank you, Chris.
All right. Coming up next after this short break, we're going to check